Hey guys, listen, I'm at work right now, so if I have to go suddenly, I'll come back to this video. But again, Joe here. Today I wanted to discuss something in nursing that has always been dear to my heart, and that happens far too often, and that is bullying in nursing. So after school, school's very intense. I think we had like a 40% pass rate, 14 years ago in my class during nursing school. So it's hard, you come out, you're beat up, you're tired, and then the bullying starts as soon as you graduate. So one thing that our instructors told us in school was nursing is the only profession where they eat their own. And, you kind of hear it and you're like, oh, okay, whatever, but it's true. And some of the occasions which I see it happening the most are during a report, when you're giving a report to the oncoming shift. And, it can often seem like the nurse that you're giving a report to wants to see what you don't know instead of what's going on with the patient, and again, the report is it's when you give a report to another nurse, it's a basic breakdown of what's going on with the patient, their assessment, their history, their presenting illness, their diagnoses, IV placement, any incidents today, any wounds, falls, blah, blah, blah. It's a basic skeleton framework of what's going on with the patient, and it's not a place to see what someone doesn't know about the patient. It's a place for you guys to communicate with the oncoming shift, what's going on with your patient before you give them over. Another area where this is common, the bullying, is, there's competition, it seems, between day shift, night shift, weekends, weekdays. There's always, there can be bad mouthing about shifts, this shift doesn't do this, or this person, this shift is known for this. And the only person or the only people that really affects is nursing, and it kind of tears away the bond that nursing should have, because nurses, honestly, and I'll get to later, but we have to stick together. We need to stick together. We are far outnumbered, okay? So, it's, and I get it too, I've been there before, but who doesn't like to feel just a little superior to the next man, by being able to put him down? So, and it's easy to do with another shift when the person's not there and the shift's not there. It's really easy to blame things on other people or to talk bad about others to make ourselves feel better. Again, I've done it. I understand. So some of the effects of bullying are that we can feel defeated. Again, the new nurse comes out, they're already shy, we're insecure, we don't know what's, we're scared, we're like little fish in a big pond and we're dealing with life or death, and we're nervous, as new grads, we're nervous. So it can make a new nurse feel defeated, It can make us afraid or nervous and anxious. I can remember as a new nurse sneaking into the charge nurse office to change the assignment because I was afraid to give a oncoming nurse report, because this nurse was always really intimidating and just not a pleasant person. So again, afraid, nervous, anxious, it can have that effect on people. And it can cause animosity and turnover rate. So again, nurses eat their own. It increases turnover rate. New grads come in, they're gone, boom. They don't want to deal with it. They're afraid. They're not used to the hostility. And, again, you've dealt with years of schooling and, life or death, blah, blah, blah. You're already dealing with a ton of stress coming into work. The last thing you need is for your coworker to just completely berate you. So, one point I want to make is there's a huge knowledge deficit between a nurse who's been a nurse for 3 months and somebody who's been a nurse for 2 years, or somebody who's been a nurse for 2 years and someone who's been a nurse for 15 years, So we're not all on the same playing field, nor should we be expected to be, and it's something we have to keep in mind. We're all at different learning levels. We've all had different medical experience. So we have to give some credit to each other there and give each other some grace and some leniency. That's very important. Because at the end of the day, like, we're here for the patient. Like I think that I can speak for everyone collectively. Like, when I say that when we went into nursing initially, we went into nursing to because we cared about people, because we wanted to see people get better. You know, we wanted to help people heal. You know, and somewhere along the way, maybe it became about other things, but you know, at the end of the day, it should always be about the patient and the patient's experience and their healing, and it should be about them, you know. And we have to support each other as nurses. Like, we, you know, let's say like the medical field is a sandwich, okay? Nursing's right in the middle, you know. So we're the meat in the middle, you know. You have the physicians, you have you know, respiratory, pharmacy, PT, OT, all those different branches, you know, and nursing is all, you know, they're the great communicator. They're somehow, you know, jammed right in the middle of that and expected to make it all work, you know. Even though you don't feel like you do, even though you may not feel like you get the credit for that, you do. Like, nursing puts it all together and keeps it all together. So we have to support each other, okay? Because you never know when the other nurse you're gonna need that nurse to have your back, and it's gonna happen, you know. You're gonna leave meds in a room. You're gonna forget to pass something. You're gonna forget to open up that antibiotic when you hang the drip, like, and you're gonna want that nurse to have your back. You know, you're gonna want that nurse that you gave report to, or that you know, that you're coming back on shift with, to have your back. You know, it could be the difference between, like, you know, someone throwing you under the bus, or someone, you know, covering for you. You know, that's just real talk, you know. So kindness is imperative, because again, at the end of the day, we have to take care of each other. You know, we have to take care of each other as nurses, as healthcare professionals. You know, we have to be united. We have way too much stress at work and in the world to come to work and be rough with each other. So, you know, again, just wanted to make a small video about my thoughts on bullying and some things that I thought were solution oriented. So everyone have a great day. Bye.